Hi, my name is Dr. Jesse Schulz. I'm a physical therapist. I work out of Mukwonago, Wisconsin. Today I'm going to be teaching you how to do something that physical therapists would call a hip hinge. Athletic trainers, personal trainers, people that are into bodybuilding, weightlifting, powerlifting would call this a RDL or a Russian deadlift more often than not. Basically, it's an exercise to engage the hamstrings, the buttock muscles, and the low back muscles to protect the spine. And what I also find is it can be used to help with people that have neural tension. If you've already done some neural flossing for neural tension of the sciatic nerve, this many times helps it resolve a bit quicker if you're an appropriate candidate for this exercise. I would encourage you to consult with your doctor or your physical therapist if this exercise is appropriate for you. Now, what we're going to need to do the exercise are either some dumbbells or a barbell. Now, some people do this exercise with more than 200 pounds, and if you're strong enough, I think that's safe to do. Many people that have back problems, I would encourage using a lot less weight. If you're using dumbbells and you cannot do this with 10 pounds per arm, you are not an appropriate candidate for this exercise. With the barbell, you should at least be able to do it with about 45 to 50 pounds. Many times, if you do use more weight, if your body's able to do it, you'll actually find that the results from this exercise will be better. When you're doing this exercise, I would recommend doing 10 to 15 repetitions for 3 sets, 2 to 3 days per week, with about a minute rest in between each exercise. Now, one of the key components of being able to do this is thoracic spine extension, which essentially is being able to do this, lifting your chest or lifting your sternum. Now, many people that have bad posture or have tight chest muscles are not able to come to this position here with your upper back. If that's the case, this will put a lot more pressure on your lower back when you're doing this exercise. And if you want to do this exercise, what you'll need to try to do is either increase the mobility and or your posture of your upper back that you can get into. One of the first things that you should do if you do have this upper thoracic kyphosis, this rounded upper back, is treat any trigger points that you find in the subscapularis or in the pectoralis major and minor muscles. Pectoralis major and minor are in the chest. The subscapularis is on the front side of your shoulder blade that you can access through the armpit, and it connects to the humerus or the arm bone. How you're going to do these trigger point treatments are you're going to find all the tender spots on these muscles, apply pressure for 30 seconds while the muscle is relaxed, and you're going to treat every spot that you can find. If you do this before you try to actually mobilize the thoracic spine, you'll have much better success. I do have some YouTube videos on treating trigger points of the shoulder girdle. Those 2 trigger point treatments are included as demonstrations within that video. I encourage you to watch it. Now, if you've already treated your trigger points through your chest and your subscapularis, if you do have upper thoracic kyphosis, more than is typical, then what we can do is start to actually mobilize the thoracic spine. Now, this is not for people that have osteoporosis to do. I think this is a safe exercise. I've never encountered anyone that has caused themselves any permanent harm with this exercise. Sometimes you can have a little bit of muscle soreness after this, but if you use common sense and follow my directions, it should be safe. You can use an exercise ball like this or a foam roller like this to help with mobilizing your thoracic spine. If you're going to use the exercise ball, you're going to put it on the ground, place the top of the ball at the apex or the middle of your thoracic kyphosis where it's rounded, and you're going to let your back sag over the ball with your arms overhead. You can either hold this for 15 seconds, 4 to 5 times. You can try to hold it for 1 to 2 minutes. I encourage you to be careful of your neck if your neck's not supported when you're doing this exercise, you don't want to have your head just hanging out in space. You can either rest your head on the ball, or you can put your hands behind your head to support your neck. If you're going to instead use a foam roller, it's the same principle. You're going to put your thoracic spine, the middle of the curve, over the foam roller. You'll use your legs to push and pull your body over the foam roller. I would encourage you with your arms to bring your elbows together, hands behind your head to support your head as you roll back and forth. One of the other things that can become stiff if you have a thoracic kyphosis are the costovertebral joints, the joints where the ribs meet your spine. To treat these, what you'll do is you're going to roll about 10 degrees to the right or to the left. You're going to feel the peak of the foam roller shift about 1.5 inches to the side of the center of your spine. And as you roll up and down, you'll be able to mobilize those thoracic joints where the ribs meet the thoracic spine. I would encourage you to do 10 to 15 repetitions of this if you're going to use a foam roller for mobilizing your thoracic spine. But again, please treat any trigger points you have in your pectoralis muscles and the subscapularis first, because it makes it a lot easier. So, to do the RDL, or the Russian deadlift, or the hip hinge, you'll take your weights or your bar, you'll put your hands on your thighs. Feet are shoulder width apart. I would encourage you to bend your knees just a little bit, at the beginning at least. At the end, once you become good with this, you can keep your knees straight. And you keep the weight on your heels, you keep your chest up, you slide your hands down your thighs as you stick your butt back. As soon as you get to the point where if you moved your hands down your legs any further, that your upper back would round, or you feel your lower back rounding, or your pelvic bone tilting, that's as far as you should go, or a little bit too far. And you should then slide your hands back up your thighs and squeeze your butt at the top. Keep your knees bent. Slide your hands down your thighs again, keeping the chest up, the butt back. And many times, if you're using an appropriate amount of weight, as you do these, you'll actually find that you're getting further and further down, or closer to the ground. From the side, keeping the chest up, knees a little bit bent, feet are shoulder width apart, sticking my butt backwards as I hip hinge down, keeping my back straight. Slowly come back up. Again, 10 to 15 repetitions of this, 3 sets, at least 2 to 3 days per week. You can also do a single leg hip hinge if you're finding that this exercise has become easy for you. To do a single leg hip hinge, what you can do is stand on one leg, keep that leg's knee slightly bent, and keep your chest up, stick your butt out as you turn your thumb behind you and lean down. Come back up. You can see with my right leg, my rear leg, as I'm doing this, I'm kicking it out behind me for balance. Right about here, I've got my left hand on the small of my back. I can feel if I went any lower down, my lower back would round. So that's my stopping point. Again, chest up, back straight, stick my butt out as I turn my thumb back and reach towards the ground and come back up. This is a 15-pound weight. If I do this with a 45-pound kettlebell, many times after 10 to 15 repetitions on the third set, I'll be able to actually rest the kettlebell on the ground. I hope you enjoyed this video. Hope you learned something, and hope this video helps you. Thank you for watching.